Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Ruchi Tondon with us. With more than a decade experience practicing in gynecology and obstetrics, she's here to discuss about cosmetic gynecology. How has she practicing, why did she get into cosmetic gynecology, and how she's practicing it now in the city of Delhi NCR? How is it growing? Why is it important for the current postgraduates to pursue this branch, and how will it help you to get established? So welcome, doctor, to the platform. It's really nice to have you here.
Thank you so much for introducing me to this platform, Dr. Ayushi. My pleasure and my honor. And you have rightly put, I was just a normal obs and gynae practitioner about 10 years ago. And since the last 2 years, I've started practicing cosmetic gynecology. Rather, it was something very innovative for me as well. It has been a very interesting journey with its own twists and turns. And it is a learning experience still for me. And definitely, I would like to put out to all the younger doctors out there that this is a very promising branch. And definitely, this should be ruled by the younger generation of gynecologists, since a lot of things that are discussed in cosmetic gynecology are very intimate and changes are still in the development mode. When I first joined, I was introduced to carbon dioxide based lasers, and we have way since evolved, way evolved. So thank you so much, Dr. Ayushi, for having me.
We are glad to have you here and discuss about such a new topic that is still evolving. So, let's, as understanding about your journey, why did you pursue cosmetic gynecology when you were doing so well with the general obstetric and gynae?
Yes, a very important question. The way you have put it is very good and very important for all the younger generation gynecologists, especially out there. Why cosmetic gynecology? Now, when I was first introduced to cosmetic gynecology, as the name suggests, I thought it is just with the cosmetics, or rather the aesthetic part. But it is not that. It deals with the aesthetic appearance of the vulvovaginal area and the functionality. We all know, with the advent of medicines, life expectancy is increasing. So every woman wants to have a good quality of life. How we can give her that? Now, post her childbearing appearance, childbearing experience, or rather post her menopausal influences on her body, there are certain changes in the vulvovaginal aesthetics and functionality, such as urinary incontinence, such as vaginal laxity. Normally, maybe around 10 years ago, that woman would have approached a normal gynecologist who would have recommended a small surgery, maybe a perineal tightening or a posterior repair. Now, with the advent of lasers and stem cells and PRP, a lot of things have switched towards the non-invasive mode. So this is a wholesome, innovative super speciality which has increased and which is still increasing exponentially in our country, and especially in the developed countries, where women realize that their needs are different. They want to live a better quality of life. This word quality of life is very important. As doctors, we should understand what our patients want. Even their small needs, a small complaint such as, doctor, I think my vagina is a little loose, should be taken very seriously. And a cosmetic surgeon understands the importance of these words that, come across in our OPDs.
Correct. I can completely agree. And, now things are really changing that you just mentioned, with the quality of life for women is the standards are changing, and, it's good to see that. So now when you mentioned that, this is the reason, you have been in this field since the last 2 years that you mentioned. So how is it evolving? How do you see it evolving now?
Well, Dr. Ayushi, the beauty of this profession is it is women driven. And that is the best part that I like about it, that a woman comes and sits in the OPD and she says, doctor, I think I am dribbling urine. It is little, but it is significant. I don't feel comfortable going outside. It is affecting my social life. Or rather, I can feel that, smell of urine since I have a very good smell sensation. I don't want to dribble in public places. I want a better quality of life. I want a better intimate experience. So these are the things that we focus at. This is what has brought out my passion towards cosmetic gynecology. And this is very important because in times to come, we are all focusing on a better quality of life. Previously, we used to advise women just Kegels exercises, post delivery, that Kegels karo, sab theek rahega. But, with advent of science, we realize there are other things that can be done, and not woman wants to go ahead with a surgery. That is also completely understandable and relatable. So definitely we should give her, the options of non-invasive cosmetic gynecology. And even if there is an aesthetic, defect, I had a patient maybe around 1.5 years back who had PCOS and who had a huge clitoral hood enlargement. And she wasn't comfortable. Even at the age of 24, she walked into my OPD with her mother besides her, saying that, this doesn't look normal. She was completely aware about the normal appearances and stuff. And we got her operated. She went home the next day and she's still so happy because she feels that, there was something that was different about her. And now she's much more comfortable.
That's very nice to know. So now if somebody wants to pursue cosmetic gynecology, what are the kind of, courses and where they can go for it?
Yes, Dr. Ayushi, initially, maybe about 5 years back, there was nothing in India, very honestly. Okay. Most of these courses were based in the Middle East, in the United States, and they were at a very high price. Obviously, you had to clear your MLE or apply for a fellowship under a trained cosmetic gynecologist with his prior approval and with the university's, approval. It was a bit difficult. Where I got it done was through the Middle Eastern branch. And I think I was one of the first batch that was actually trained in India. This was a diploma in cosmetic gynecology, and it was supported by the American Aesthetic Association. And it was a complete course that was, run by trained and certified cosmetic gynecologists. And it was about, I think, less than a week of training. And very selected people, but obviously this was in the pre-COVID times. So we had hands-on training also, we had real patients also, and I'm still in touch with those people. And right now, this is being done by International Association of Stem Cell and Regenerative Medicine, where some very qualified people, and rather it has impaneled some of the largest, chain of gynecologists worldwide, and especially cosmetic gynecology, some of the most renewed people in this profession. They have on panel, and they are also doing fellowship courses, which is almost a 3-month course. And they are doing diploma in cosmetic gynecology with all hands-on training. And it is usually divided into 2 parts. That is, the non-invasive training and the invasive training, depending upon the availability of patients. And I would recommend this to all upcoming gynecologists or even people who are interested in aesthetic medicine. This is a very good opening, very promising opening. Especially I'll be talking about stem cells. We all know previously there was no much of, study on stem cells, how it will benefit. But now stem cells are routinely being used even in IVF setups, in patients with thin endometrium, in patients with poor ovarian reserves. And I myself have done so many patients and I've seen very good results. I think the ball is in our court. So we all have to, put our efforts into it, and we have to contribute to the research work also, and definitely the results also.
Definitely. Really nice to know about the places also where a person can pursue. So what do you suggest? These trainings should be done by, any gynecologist who pass out, or there should be some mindset before that? What is your suggestion?
See, it's very important to understand what you want in life.
Correct.
A cosmetic gynecology has a very good quality of life for a gynecologist also. Obviously, there are no emergencies in it. Definitely. And initially it was done when the era of cosmetic gynecology hadn't evolved. It was done by plastic surgeons. But over a period of time, we have realized that nobody understands the anatomy of a female as well as a gynecologist does. Let's be honest about it.
Yes, yes, yes.
And a woman who has delivered another woman knows that, she's much more prone into having, some amount of laxity or some amount of, perineal deficits, or she's the one who might come back with, urinary incontinence. So I think that all gynecologists should think about it. There was an era when everyone was running ahead with IVF. I think IVF is saturated at the moment. We have good amount of fertility experts in our country.
Yes.
And even in IVF, this is going to help. Like I told you, we are using stem cells, we are using PRP, we are using regenerative medicine in so many aspects. Still, it is going on developing and developing. And believe me, we being a population of 1 billion people, we have a bigger sample size for study. And we have much more scope than the developed countries.
Definitely.
So definitely, I would like to encourage all, even probably even women, students who are doing their undergrad can pursue aesthetic medicine, and they can go ahead with the cosmetic gynecology.
That's really nice to know, especially for graduates to pursue something.
Exactly. See, there might be some amount of students who might develop that interest from the time of their graduation itself. So you don't have to necessarily be an MD gynac to pursue this. It can help you. It depends on what you want in your life. And it's a very good, very promising, with a very good quality of life.
Definitely, because there no emergencies is a big thing.
Definitely. And it's really very, welcoming. Women go home very happy that you've made them, beautiful and functional in a way.
That's very nice to know. So now if, somebody after aesthetic medicine, as you mentioned, that graduates can also do that. So as for in the fertility thing also, that there are specialized employments in the same thing with fetal medicine also. Is there with cosmetic also that there are specialized employment with hospitals?
Yes, of course there is. In fact, when we started, we were the first people, I'm talking about Queen's Gynecology, we were the first people to start cosmetic gynecology in Max Superspeciality Hospital. And this is, gradually taking over everywhere, even in the smaller clinics and even in bigger institutions. And recently, even AIIMS Rishikesh has started an MCH course, which is a 3-year proper course with their own, brochures and their own requirements. They started with the SR-ship, I think about last year. And now they've started a proper MCH in cosmetic gynecology, which is a 3-year full-fledged course.
Okay, great. Really nice to know about the MCH is also starting, and this is a big thing.
Yes, so you don't need to run outside or anything now. Things are very much available in, the cities and metros, and definitely it's a very good profession.
So now when you mention about metros, is this scope, the job opportunities in the, in your private setup as well as in the hospitals are there in the metros, but what about tier 2, tier 3 towns? Is there a scope there for the, gynecologists there?
Dr. Ayushi, I'll be very honest with you. You'll be surprised that a lot of our clientage, a lot of our patients come from the, the lesser, from suburbs or from, not from cities. They come from the smaller towns because they are much more aware about their bodies and their physical needs. And it is beautiful to receive them. Believe me, it's very encouraging to, get a patient who is completely aware about herself and who wants it. It's all about your mindset. It doesn't, it doesn't mean that if you're in a metro, you have better opportunities or cosmetic gynecology is better off there. I'm sure gradually this will spread everywhere. It is one of the fastest growing subspecialties right now.
Okay. Nice to know that these, and especially when, you as a gynecologist in a tier 3 town also have a need of this is a great thing.
True.
Now, when you previously mentioned that people used to approach the plastic surgeons for this as well as cosmetologists, I'm sure. So why will, now a normal lady prefer a gynecologist? It's a cosmetic thing. That why don't you think that this will be, a cutting edge between the two professions?
Sorry for my imprudence, Dr. Ayushi, but I'll ask you a simple question. Okay?
Yes.
let's just assume you have a problem. Okay? I'm not discussing what problem you have. I give you a male surgeon. I give you a male plastic surgeon. I give you a normal gynecologist. And then you have me, a cosmetic gynecologist. Whom would you prefer? Open question.
That's true. That's true.
So you've answered the question yourself.
You have to, one thing with this thing is that cosmetic gynecology is still not that.
Please, no harm to my male colleagues. I completely, respect them. I've learned everything from them. But this is just an open and it's a very practical question. I see this every day.
Yes, yes. And see, if I know that you are practicing cosmetic gynae, definitely I will go to you. Irrespective, if you ask me irrespective male or female, if I know there is a cosmetic gynae kind of a thing, I will definitely go for that. Till I do not know that there is a cosmetic gynae, that's a different thing.
Now let's assume another example. I'm a woman sitting at home who knows that there is certain problem with me. Okay? I go up to Google. I put up 2 words, vaginal laxity. Okay? What will pop up first, as in today's time, is going to be cosmetic gynecology. And I will go up to her, definitely, knowing that she's the right person.
Correct, correct, correct. Thank you for answering this question. So this is one thing that I was thinking about. So now, how do you, now when you mentioned previously also that, patients come up to you with slight problems that this is what I'm facing. But is it because this is a normal procedure that happens, the loosening and everything happens post-deliveries? So is it that you can also offer something like this to the patients post-delivery? Is this the case also?
Yes. Rather, even 4 to 6 weeks post-delivery, if we feel that, a woman has had, suppose she has delivered a huge baby, maybe around 4 kg delivery and stuff, we can start with the sittings. They are completely non-invasive, OPD-based procedures. There's no downtime. Hardly in 25 minutes, she can go back home without any pain, without any anesthesia. And these are all happy, very patient-gratifying procedures.
Correct. So,
and this is where it should change. We cannot, leave it to, baad mein aao, dekhenge, or wait for a few years. I think it should change. Why not? Why? We should give her a good quality of life from the day she delivers. She should be, back to where she was.
Correct. Completely agree. So during this time, have you also met some kind of patients that have come up to you with unreasonable, demands?
Yes, Dr. Aisha.
You have told them that,
I told you this. I discussed this with you also on the phone. I had I think a minor girl rather come up to me, showing me a picture. Maybe she had downloaded from the internet that I want this to be the physical appearance of whatever. And I had to tell her that, beta, you're very small. Number one, you have not even reached, your appropriate growth for age. Please, let's wait for it. So there's a lot of awareness involved, and there's something called as body dysmorphic syndrome, which we as physicians, all physicians have to be very careful of. There is a particular subset of patients who will think always that there is something wrong with them, and they will come to you. In your practice, it is up to you to, isolate these kind of patients or counsel them or strengthen them mentally.
Correct. That's really nice to know. And, because cosmetic is a thing that heals and cuts also. So, I'm sure.
We are surgeons. We have to be very careful about our patient selection. We have to understand the difference between our patients' needs and what is appropriate for them. There's a very fine line. And we have to draw it over there. And we have to put our foot down that this is realistic. This is not realistic.
Correct. That's very nice to know. So now, what is your suggestion for the, for the current gynae obs postgraduates, or now when you tell me that this can also be pursued by the graduates? So what is the suggestion for them that, how is this field evolving? Something that you had motivated you to pursue this for them? What do you think that you should, something that motivates them?
Yeah, I'll be very honest. When I joined this, I wasn't at all aware, because we have been educated very old school that, ye sab cheezein to hoti hain, koi baat nahi. There's a particular mindset in which you're trained in a medical college.
Yes.
The day I joined and I sat in my first training in cosmetic gynecology, I had to unlearn so many things. I had to unlearn, the fine line that, like I was talking about right now, in between a patient's expectation and between what I can give her. There is a lot that we can give our patients. And I would encourage all of you out there, to, you know, come and join this beautiful profession. It's a very happy profession. And believe me, there is just happiness all, and no emergency, no stress, and very upcoming, very promising.
Hmm.
So please think about it. And we are the future, and there is still a lot of things that are, you know, developing, the lasers, the techniques, a lot of things are still, you know, evolving. We should contribute towards it. It's very important.
That's true. That's completely true. Things are evolving really fast in medicine, and really nice to know about
And
this.
I hate, sorry to say this, but I hate, you know, when I was just going through the literature again in cosmetic gynecology, they always quote, you know, the developed countries. Come on, yeah, we are a population of 1 billion. But there is so much more that we can put in terms of research, in terms of our patients. We should be the forerunners. We should be the pioneers of cosmetic gynecology. So please come out there.
Yes, yes, I can completely agree. We as doctors have seen so many patients in our graduation itself that that's very rare to see in the developed countries that any doctor has done that.
Exactly.
So it's very nice to understand about cosmetic gynae as a branch and to understand how it is evolving, how important it is, and now understanding that the graduates can also pick this branch up as is really nice to know. So thank you so much, Dr. Ruchi, for taking out time and helping us.
My pleasure, my honor, and I am open to any queries. I'm open to anyone who needs to ask how it is done, or how, to pursue it, or how to practice it. People who have pursued it, how to practice it.
Yes.
I'm completely humbled, and it will be my honor to help them out. I am available at Queen's Gynaecology. That is my social media platform, or you can reach me out individually. I think thanks to Google.
Yes, she's there on Insta as well. So
Yes.
you can actually reach out to her on Queen's Gynaecology, which is her venture in Delhi. And she's doing really well with that. So thank you so much for taking out time about this. And I'm sure this is a very much needed topic to talk about in gynecology now, because with things changing, I'm sure this will definitely help people to get a better work-life balance and a better lifestyle as a gynecologist.
And quality of life, very important for we females. We have to realize, and we have to change our own perception of our own needs.
Correct.
Of course, I'm all about women empowerment, so I definitely stand by cosmetic gynecology.
Yes. So nice to know. So, to understand everything about you as well as cosmetic gynecology. So I'm sure most of our audience who are listening to you will agree with what you're saying and understand about cosmetic gynecology in depth. I'm sure people will be, reaching out to you to understand more about it and help them to practice that in their normal practices as well. Thank you so much for taking out time. Thank you so much to everyone for joining us at this point in time to understand about such an important branch that is evolving and that is currently new in the market. So if you want to establish yourself as a cosmetic gynecologist or a cosmetic surgeon, do pursue it now, because this is the time to pursue it and to establish yourself so that 10 years down the line, you have your space and your niche to work on. Thank you so much, Dr. Ruchi. Thank you so much, everyone, for joining us. Do follow the Social Doctor as well as Cosmetic Gynaecology on Instagram as well as YouTube. I'm sure there also with the Social Doctor you can find all the old videos about career growth that can help you to guide you in the right track where you're looking for. And in case any other doubts that you are not able to find answers on, do reach out to us. We will help you to guide. We will help our best to search answers for you. Thank you so much, Dr. Ruchi. Thank you so much, everyone. Bye-bye, everyone. Good night.